Hi, my name is Caroline West. I'm one of the anaesthetic consultants in the South Eastern Trust, and I'm just going to tell you a bit about Remifentanil, which is one of the pain relief options that we have available for labour and delivery suite. Remifentanil is a very short-acting morphine type drug, and it's given through something called a PCA, which is patient-controlled analgesia, which means you have control over when you get it. It's a morphine-based, it's part of the morphine family of drugs, so you can have it, most women in labour can have Remifentanil if you don't have an allergy to morphine-type drugs, and provided you're over 37 weeks pregnant. Remifentanil has been used in the Ulster Hospital since 2004. It's been extensively researched worldwide, and there's no known side effects for the baby. It's a drug that is metabolised very quickly by the mother and the baby. Remifentanil needs to be set up by an anaesthetist, so it does depend on an anaesthetist being available. You might have to wait a short time, hopefully not too long, before you get it, but you won't necessarily get it just as immediately that you ask for it. We need to monitor your oxygen levels while you're on it. Sometimes it makes you breathe just a little less frequently or less deeply, and some people need a wee bit of supplemental oxygen when they're on it. Other observations are the same as would be done during your labour anyway. You're given a button to press, and you need a cannula inserted that's just purely dedicated for the Remifentanil. You press the button as soon as you feel a contraction coming on, and you then get a shot of the Remifentanil, which ties you over that contraction. The Remifentanil takes 20-30 seconds to work, so the idea is that you press the button as soon as you feel the contraction coming on, and so that you get the drug when you need it. There is a 2-minute lockout time so that you can't overdose yourself, and it's important to get into the right rhythm with it. The Remifentanil will probably make you feel a wee bit lightheaded and dizzy, can make you feel a bit sick. If you're feeling sick, you can get something for that. The effects wear off very quickly, so if you try it and you don't like it, you're not going to be left feeling dizzy and sick or lightheaded for very long. And most women do find it extremely effective, although 1 in 10 women do still go on to have an epidural, and that's perfectly alright to do so. You can also use Antinox when you're on the Remifentanil as well, if needs be. So when you're on the Remifentanil, you don't need to be in bed, you can be in the chair, and the baby doesn't necessarily have to be attached to the CTG monitor unless there's another indication for that. There is a leaflet with further information on Remifentanil available on the website.